how has the field changed in dermatomyositis? Well, it is a different field. I think that not so long ago, there was a whole question of whether people who had only skin disease even had dermatomyositis. And so there was a lot of need to almost think about how do we classify patients, and that took some time. And so now we can incorporate patients with skin predominant disease into the diagnosis of dermatomyositis. Having said that, patients really have a hard time getting diagnosed, and it can sometimes take a decade for them to really get the proper diagnosis. So the field has evolved where I think there's a better understanding of how to classify the disease. There's some better understanding about what maybe causes the disease. There's genetics, there's triggers, and I think they're all things that are being studied, and also trying to find better therapies, which is something really that wasn't happening. There's only been one drug approved for dermatomyositis in the last 75 years, and so it's time for the field, now that it's developed the way it has, to get some new treatments. The field of dermatomyositis is becoming quite exciting, probably the most because we're better able to identify those patients. We see a whole range of ways that people present, but we have pretty good confidence when people are diagnosed with the disease. And we are getting to a point where we are going to be able to treat people much better. We did finally get an approval for dermatomyositis when IVIG was approved a couple of years ago, and that drug does work for patients with muscle disease, but also skin disease and probably lung disease. So it is something that is available, but it's also something that we don't necessarily have to use in every single patient. And then now there's a lot of experimental treatments coming along that will address some of the driving forces of the disease, and some of that will be blocking certain interferons, in particular interferon beta, that seems to be a big driver of the disease. And there has been a recent phase 2 study that looked very encouraging from the standpoint of blocking interferon beta and seeing improved muscle and skin disease. But there are other approaches that will also decrease interferons in the skin and muscle that are drivers, and these can involve certain pathways that, such as JAK or TYK inhibitors, that can also lead to decreased interferons and decreased disease activity. So we're really in an exciting time in terms of being able to think about better treatments.